For this Fun Fact Friday, we're going to talk about a patient case of ectropion and what we can do to try and relieve it. We've talked about ectropion before, which is the turning out of the eyelid. And this can happen for a couple of different reasons, but what we see most primarily or predominantly is in patients that have worn a prosthesis for a long period of time. The combination of gravity, the weight of the world weighing on us, and the skin laxativity, that collagen and elasticity is just not there like it used to be. Between those two things, this lower lid starts to get droopier and droopier and droopier. And in some cases will really start to turn out like in this case. And you say, well, what do we do about it? And in some cases, there's kind of not a whole lot we can do. And when we run into those physical limitations, that's when we have to rely on the other eye doctors, oculoplastic surgeons, that sort of thing to help relieve what's going on in that socket. But essentially what we can do as ocularists is tune up how this prosthesis is fitting in that space. We can use the concept of a hammock, taking the 2 points further away to try and bring up the bottom. We can do that. You can see that extension done here in the clear, which is beneficial. But the problem is if it's still kind of stretchy in that skin, it can just continue to stretch out further and further and further until we have issues keeping the prosthesis in the first place. If this is so turned out that we don't have a pocket or anything to tuck into, that eye is just going to keep falling out. And if that happens, that's when we refer you to somebody else to have a little tune-up done on this outer corner. This is called a lateral tarsal strip tightening. The outer corner of the tarsal strip here is grabbed, it's shaped like a banana in that lower lid, is pulled up and tacked with a couple of little dissolvable sutures until they go away. And that will then stay there and relieve some of that ectropion, especially when we can reshape the bottom to really tuck into that lower lid area. And that is today's Fun Fact Friday on ectropion. We'll see you next week.